Hi, my name is Greg, a nutritionist and physiotherapist, and today I'm going to talk to you about living to a cardiac lifestyle. Recently, a Dutch study has shown that choosing to consume just 6 key foods can have an amazing impact on your cardiac health. These foods included 3 serves of fish per week, 2 glasses of red wine per day, 400 grams combined of fruit and vegetables, and each in a small portion, a teaspoon of garlic, almonds, and dark chocolate. As stated, 75% risk reduction in chance of heart disease. And that is an amazing result from just these 6 key foods. This goes to show how much living to a cardiac lifestyle can help with your overall health and in reduction of your risk of heart disease. Of course, there are other dietary modifications that we can recommend. First and foremost, consuming lean protein rather than high-fat proteins is very important. Next, as stated in the study, a high quantity of fruit and vegetables. But we'd also add here a high quantity of legumes and beans in your diet and a moderate quantity of nuts and seeds. In moderation, we should consume from the grain group. However, here we should really be careful in respecting serving size because we can overconsume energy and hence risk obesity if we eat too much in the carbohydrate range. We're not talking no carbohydrates here or low carbohydrate, but a moderate and controlled carbohydrate intake. There's a lot of discussion about butter and margarine, but this also comes back to how many foods you're actually consuming that require you to put a spread on your food and how large a spread you actually put on your food. Obviously, if you're going to consume a lot of the grain group, which often require oils and sauces to be added or spreads, then you're going to have to be careful about how you do this. And this is why we suggest a moderate carbohydrate diet is very important to avoid over-consuming both the energy from your carbohydrate-based foods, but also the rich sauces and spreads that often goes along with flavouring up these blander foods. Obviously, exercise is important. How much exercise do you need? Traditionally, it has been stated that you need about 30 minutes of exercise in an aerobic fashion for cardiovascular health. However, now many people believe this is not enough, and for those people who have already gained weight, 45 minutes of exercise per day is necessary. What level of exercise? It needs to be at an intensity where you are short of breath, but you're still able to speak sentences, so you're not overexerting yourself. Of course, exercise can be a difficult commitment for some, and here it is probably more important to change the term a little and consider it to be activity rather than exercise. When we consider it as activity, we can add things like social dance, walking the dog, playing with the grandchildren, as long as it reaches that exercise intensity that makes us slightly short of breath. For those people who can't yet achieve these 30 minutes and 45 minutes of exercise, it is okay to break exercise up to begin with and work towards the 30 and 45 minutes today. A little bit of exercise is better than nothing, and in fact we get the greatest gains from exercise in the first portion of exercise that we do. So start to commit to any level of exercise is the first step in getting a cardiac benefit. There's been a lot of discussion in the past about type A and type B personalities, and recent evidence suggests that it's not necessarily a personality type, but certain aspects of personality that are important, such as the level of depression that a person may be experiencing and the level of anxiety. Therefore, it's important to work with depression and anxiety to diminish our cardiac risk. And here's some of the many mind-body techniques that helps to calm the mind, the body and the soul are important. Activities such as yoga, activities such as Tai Chi, meditation, relaxation. But also consider the less structured forms of relaxation, such as just watching the day go by, watch the sky, daydream, soak in the bath. Anything that helps us to feel happy and less stressed is important. Of course, working on our emotional intelligence is also important. Dealing with our relationships so we avoid relationship conflict. Any of these activities are not only going to help with our cardiac risk, but also are going to help with our general well-being. Quitting smoking. often difficult for some, perhaps the greatest lifestyle change that is going to give you long-term health benefits. Realise that most smokers do try and quit many times before succeeding, but once they do succeed, the health benefits cannot be underestimated. You may need social support. In fact, most people, even within a social support program, have difficulty quitting smoking. You need help with medication perhaps, and often with other lifestyle changes that help with the quit smoking programs, dealing with anxiety. And I should also note, those people with eating problems, with dietary problems, where giving them a diet is very hard to commit to, often need to deal with emotional issues as well. So quit smoking cannot be underestimated. A further consideration is taking on a preventative supplementation program, and there are many supplements that have been shown to have cardiac benefits. For instance, fish oils, are demonstrated to have benefits in reducing cardiac risk. We can add concentrated garlic, ginger, turmeric, moderate levels of vitamin E, and other supplements, CoQ10, particularly when using a statin drug, which may be necessary to decrease our cholesterol levels. We also should consider those other risk factors that lead to increased cardiac risk, such as diabetes and treating blood pressure, and they may each have their own supplementation programs and associated medications required to control them, because an increased risk of cardiac disease does arise from the fact that one may have diabetes and the fact that they may have high blood pressure or depression. Therefore, it can be often important to see an integrated medical practitioner if you choose to take on a preventative supplementation program. Otherwise, you may be taking on far too many supplements that you don't necessarily need. You really need to get specific with your supplement programs if they're going to work, and blend them in with whatever your doctor is doing so that you have a consistent approach to the treatment and reduction of your cardiac risk factors. A final word that must be mentioned, and it cannot be underestimated, and that is motivation. None of these changes will succeed if you are not motivated to commit to them over the long term. And motivation can be a big issue. Look in your life for the motivation. It does not necessarily have to be just to reduce your cardiac risk, which can be an abstract concept, but to have a better life, to be able to play more with your grandchildren, to be happier, to be healthier, to live a more passionate life. All of these motivations will probably be more enforcing than just saying, oh, I want to decrease my cardiac risk. Because unless you have a pre-existing cardiac disease, that can be an abstract concept to take on until those hammers hit home and you say, oh, I must do something important about it. Also realise that in motivation is also the key is to realise you do not need to be 100% perfect in what you do. Many of us lose motivation when our programs drop off. So therefore, sometimes it's better to build ourselves up by getting 5% better every day. Slowly weaning into doing more exercises, eating to a better lifestyle, controlling your stress. Do it slowly. 5% per day adds up. 5% per week over the course of the year means you'll be much better. But if you try and commit to a 100% program in the short term, over 4 weeks, over 8 weeks, but do not commit to it over the longer term, then that 100% program is not any better. In fact, fails compared to that gradual improvement in your cardiac health. So in summary, living to a cardiac lifestyle can improve your whole life, not just your cardiac health, and it is really worth committing to over the long term. I'm Greg DeYoung. Go out there, get healthy, get happy, and be passionate about heart health.